Well, MERLIN is a European Commission-funded programme of work looking at studying mesenchymal stromal cells in the setting of liver injury, in particular the type of liver injury called primary sclerosing cholangitis. This programme is coordinated and led by me in the University of Birmingham and involves multiple European partners who are looking at different aspects of how these cells might work in that setting.
Primary sclerosing cholangitis is a rare disease that affects patients often who have inflammatory bowel disease or colitis. It's a disease of their liver, and in particular it's a disease of inflammation of their bile ducts. And what happens is that the inflammation in their bile ducts causes scarring and narrowing of the bile ducts, and this stops the bile from exiting the liver properly, and in addition leads to scarring of the liver or cirrhosis. Unfortunately, we don't actually know the cause of this disease, and that's one of our biggest challenges to date. Without knowing the cause of a disease, it's very hard to get the best treatments. We don't yet have all the answers, but we hope that with research conducted in Birmingham and across the UK and the world, that we'll get closer to understanding what causes this terrible disease.
What is unique about the MERLIN programme is that it's a combination between fundamental science, clinical science, and also clinical trial. So I have a background in fundamental science, and that's where my expertise is, but this program gives me a unique opportunity to discuss my work with scientists in other disciplines than my own.
The overall aim of this MERLIN program is to invent new efficient therapy for liver diseases, because there is no current effective therapy for these chronic liver diseases.
I've been very fortunate to go and visit Opson Therapeutics in Ireland, and they showed me some really interesting techniques that I've taken back here and I'm now currently using in the lab in my own experiments.
We received funding for a biomedical research unit in liver disease in 2008. The funding was awarded to the Centre for Liver Research at the University of Birmingham and the University Hospital Birmingham NHS Foundation Trust, and it was given by the National Institute for Health Research to set up our biomedical research unit. The aim of our biomedical research unit is to drive innovation in the prevention and diagnosis and treatment of liver disease, and to translate advances in our basic medical research for the benefits of patients.
Translational medicine is really when we move our findings in the laboratory into the clinical setting, and it really excites me being able to move groundbreaking findings in the lab into patients, because I see the huge unmet need in my clinical practice. I've been very fortunate in Birmingham that I've been able to run a couple of trials. One was looking at an agent to treat patients with fatty liver disease using a drug called liraglutide, and I've also been involved or ran a trial using patients' own bone marrow-derived stem cells to try and reduce scarring in the setting of liver cirrhosis.
A lot of our patients end up needing liver transplantation 10 to 15 years after development of symptomatic disease. However, to date and over the last 30-40 years, we don't have a medical treatment for PSC, and this is a great unmet need in liver disease. At present, those patients who run into problems, who have progressive disease and who get cirrhosis and end-stage complications of liver disease, need to have liver transplantation. And this is a very effective treatment for them, but clearly what they would like is medical treatment that stops the inflammation in the bile ducts and lets them lead a normal life. That's why we're so excited in Birmingham and around the world to be taking part in new drug trials for this disease.
The MERLIN programme consists of several different work packages, and most of the other work packages look at the function of mesenchymal stem cell, what they do when you introduce them into the body.
I'm currently working with work package 1 to investigate the role of immunomodulatory function of stem cells in preclinical models of primary sclerosing cholangitis.
Mesenchymal stromal cells are a type of cell that is found commonly in the bone marrow, but also in fat and also in umbilical cord. And what's interesting about these cells is that they have an ability to reduce or dampen down inflammation.
What's going to happen if we take the mesenchymal stem cells out of the system is that's going to have an effect on the progression of PSC.
If we can show that the infusion of these stromal cells reduces their liver blood tests, then we can be confident that the inflammation in the liver is better. And this means that we can take this study from a small number of centres in the United Kingdom and plan a much bigger study across Europe and hopefully the world to really show that this new therapy could really benefit our patients with PSC.